Hello, my name is Gareth. You're watching the Hub Online Network, and it's April the 7th. We got a lot of stuff to go through today again, so let's get to it. All right, so just a couple of housekeeping things that I didn't get to yesterday. I wanted to say thank you for everybody that's watching. Last week we had 9,087 views on all of our videos accumulated. So thank you all very much for liking, sharing, subscribing, all that stuff. We've had a bunch new people like our Facebook page. So it's been quite an upswing for us. So again, thank you all very much for that. If you are at home and you want to talk about anything, doesn't necessarily have to be about COVID-19, give me a call at 250-457-0538, and I'll take your call live during the show. Now, what are we looking at here in terms of numbers? So let's get right off to the bit I don't like talking about all that much, the numbers. So, yesterday, before the show, I just wanted to, might as well talk about that. So yesterday, the numbers that we were looking at were, this was, 1,260,000, no, sorry, that's wrong, this one. 1,342,331 total cases, 74,470 total deaths so far, 39,480 people in the hospital, with 278,607 people recovered. Now that was yesterday before the show. So in a day, it is now sitting at 1,427,732. So that's quite a jump. That's about 800,000 people. Total death is now 81,896. That's a difference of about 7,000 people. It's about the same for total illnesses. It's only gone up by about 300 people, or people in the hospital. And people recovered has gone up. So today it's sitting at 303,450, which is a good number, and it's gone up about 27,000 people that have recovered in a day. So if you're one of those people that have recovered, congratulations. Hope you are feeling better. How that translates into BC is we have 25 new cases across the province, giving us a total of 1,291 as of today. Which means 603 people in Vancouver, 458 people in Fraser Health, and we've seen no change in the numbers in the Island, Interior Health, and Northern Health, but those numbers are sitting at 79 for the Island, 128 in Interior Health, and 23 in Northern Health. Unfortunately, this number also brings 4 total new deaths, but 805 people have now recovered in BC. There are currently 138 people hospitalized, with 66 in the ICU. So that is the numbers. Now, where am I going to start here? So, Justine Trudeau's speech from this morning. Companies are stepping up. So there's a few new companies that are making gowns and stuff. So Stanfields and Canada Goose are making medical gowns. And there are 30,000 new ventilators being made. Now, the question that a lot of people were asking the Prime Minister was, do we need 30,000 ventilators? If we make 30,000, so Justine Trudeau is saying that if we have 30,000, that's for hopefully a worst case scenario. But if we make them, maybe we can give them or sell them to other countries that are in more of a dire situation than Canada is. So hopefully we don't need the 30,000, but we can pass them along. And I thought that was a very Canadian thing of Justine Trudeau to say. I thought that was a very good thing if it comes to that. So, some things that have come to light about the CERB. So let's start off with the changes. So the government does realize that this benefit for people that have lost their jobs to this, they know that it's not perfect. So there are changes coming to the CERB that include people that are self-employed, people that work less hours. So they keep specifically talking about people that work in the health industry that are not in the hospitals. So it's more like care workers of the elderly. So those people that work a little bit less than full time would be eligible for the CERB, as well as students that are going into the summer that would normally have a job. They would also be able to apply for the CERB. Although those groups can't apply yet, this is something that they would be going after in the future. So these are the changes that they're going to make. Now, for people that have already applied and might not understand, just so you are aware, this CERB is taxable, but they do not take tax payments off, or they do not take taxes off of those payments. What does that mean? That means that at a tax time, you will have to submit this amount onto your taxes. Furthermore, it is recommended that 25% of the total that you get is saved for taxes in 2021. So if you're getting the full benefit over the next 4 months, which works out to about $8,000, they're suggesting that you keep $2,000 of that to be able to pay back to the government in 2021's tax season. So just so you are aware, this is not free money. This is money that is taxable. And if you are somebody that doesn't need this money and they find out that you've applied and you're getting it, but you don't need it, there apparently will be very strict repercussions for that. So if you don't need it, don't apply. If you're working, don't apply. I'm sure that there's something that will be coming down the pipe for something like that, but apply if you need it. Now we do also have Jessica at home answering your comments and questions on our chat. So thank you, Jessica. Keep up the good work that you have been doing. Now tomorrow, you can expect on this show a larger talk about, hang on, sorry, I have a, should sound better now. Let's turn that down. Sorry, technical issues. There we go, I should sound better. Okay. Tomorrow I'll be doing a little bit of a, not an expose, but a little bit of a larger talk about testing. Testing is what I'm going to be talking about. So why people get tested, why they don't get tested, how many people are being tested, all that sort of stuff. So that'll be the main topic of tomorrow's video. And I won't get into that today, so I will save that for tomorrow. So I also want to give a shout out to the people that viewed yesterday. So people like Marilyn Anderson, Joe McAvaney, Naomi Marvin, Bill Perry, who is apparently from Saskatchewan. So if you're watching Bill Perry, thank you for watching from Saskatchewan. Actually, if you're watching, I'd like to know how Saskatchewan is doing. So give me a call if you're watching this, or if you're watching this after it's posted and you missed it live, phone me tomorrow. I'm going live again at 4, so give me a call then. I would love to know how Saskatchewan is doing in this time. So Bill Perry, Nadine Drani, and the Skeetchison Reserve. So again, Nadine, if you're watching this or you're watching this later, and Karen Warren, spit it out. Hi, Karen. Shout out to Karen. Thank you for watching. So Nadine, if you're watching, I'd like to know how Skeetchison is doing as well. Karen, if you're watching right now, I'd like to know how Bonaparte is doing. So give me a call, and I would love to talk to you. Due to COVID-19. Okay. Due to COVID-19, Cache Creek Badminton has been canceled until September. So if that is something that you were wanting to do this summer, it is canceled until September, unfortunately. I'm sure that badminton is a lot of fun. Just making sure I'm not missing anything on my papers here. Okay. Um, and I'd like to give a shout out or make a IDA Pharmacy, which is still open, will be closed for Friday, April 10th to observe Good Friday. However, they will be open again on Easter Monday as usual, and a big thank you to all of the IDA staff. You guys are doing awesome. Now, yesterday we had a little bit of technical difficulties, and so if for some reason the show cuts out again, it does still record me live, and I will be posting it to YouTube. So yesterday I was almost done the show. It cut out at 43 minutes or something. So the last minute and a half were on YouTube. But I will just say the thing that I talked about yesterday at the end of the show, which is some boredom busters. So this is a topic that is not so serious before I get into some other more serious topics. So there's just a list of things I came across on Facebook to give some answers to. So for example, what's a TV series that I like to watch? Firefly. It's a Joss Whedon show. It's only one season long. There is a movie to it called Serenity, so it's a good little show to watch. Lots of fun. What book series would I suggest? It's a book series called The Black Prism. It's about 5 books long. It is completed now. It's about people that can take colors and turn them into magic. Lots of very interesting. What meal recipe do I suggest? If I was in a situation where I wanted to make something, it would be apple pie. A song or album that I would listen to try and pass some time would be Jeff Wayne's War of the Worlds. And if you think that sounds interesting, definitely check it out. It's a musical version of the story of War of the Worlds. Very techno-y, lots of fun. Check it out. Website, of course, would be YouTube. You can just pass days and days and days and days and days on YouTube. The podcast that I would listen to is Joe Rogan, mainly because he gives some interesting insights. He swears a lot, though. But his podcasts are like 3 or 4 hours long, some of them, so it passes a lot of time. And if there are some board games I'd like to play, it would be Ticket to Ride or Nightmare. Nightmare is an interesting one because it takes an hour. And you can go on YouTube and find the video to play with. And you watch a video and play the board game, and then this guy interacts with you through the video. It's pretty interesting. Came out in like the early 90s. The game itself comes with a VHS tape, but nobody has VHS players anymore. Or if you do, message me here and let me know. And if there was a phone game, especially right now if you're looking for exercise, would be either Pokemon Go or Zombies Run. So the Zombies Run app is a thing that gets you to run up to 5K, so it trains you to run 5K at the end. So those are 2 apps. Those are my boredom busters for today. I'll maybe do another list for tomorrow, change it up a little bit. And that is what was missed yesterday on the show. I'm going to read the update from the doctor's office in Ashcroft. So, dear patients, your health is our #1 concern. To protect you from COVID-19, you can now see your doctor and clinic care providers by video and telephone. This allows you to get care while social distancing or quarantined. After your video or phone assessment, if you need to be seen in person, we will make arrangements to do so safely. To sign up for video or telephone appointments, please call 250-453-9353. And before your appointment, please use the website for tips and preparation to use the video or telephone for clinic visits, which I'm sure Jessica can put into the comments as per usual. Thank you, Jessica. The exercise illustrated areas. Ooh, and I got a phone call. Hello, Gareth here.
Office at Ashcroft.
Christy, good. About yourself?
Not too bad.
I
would like to update the fine people of Ashcroft and surrounding area on what's going on with our office.
Oh, wonderful. Thank you so much.
Oh, no problem. So, we have gone to virtual services at the office, which means that we are completely available for phone calls with the number that you would find online. It is 453-24, or via email, which is info@ashcroftes.ca. So even though we're not there, I know lots of people like to stop by and look at our job board. Even though there may not be anybody in the office, we're still here. We actually have moved our job board that is inside the office. We've moved it to the window, but we don't want, with respect to the social distancing and whatnot, we don't want too many people out front, but feel free to stop by and check out the job postings out front. And yeah, so that's kind of what we're up to.
Awesome. Well, how have you been personally? What have you been up to?
Well, just interestingly enough, working from home is kind of cool, actually. So I'm fortunate enough to have a good internet connection. But personally, I've actually taken this time to also introduce a new puppy to the family.
Fun.
So on the weekend, we've adopted our fourth Bernese Mountain Dog. So he's an 8-week-old pup. So I'm able to kind of be working and also sort of letting him in and out every hour on the hour to go use the bathroom outside. So yeah, so it's good.
Well, amazing. Right on.
Mm-hmm.
So are there many new jobs sort of coming up right now, or?
Well, I can speak sort of broader than necessarily our town per se. But as everyone's seeing, it's the grocery industry, it's the medical industry, it's those type of industries that are actually thriving right now. So if some people are willing to commute to, say, Kamloops or even Merritt, because there's some big box stores there, then yes, there are lots of opportunities. Locally, we have our Desert Hills and our Horsteins and those type of places, and the local ranches. It's business as usual. The cattle need to be fed, the crops need to be watered, so there's irrigation jobs, there's ranch hand jobs as per normal. So if anyone is curious about those jobs, we can definitely help them connect to applying for those jobs.
Oh, right on.
Yeah.
Cool. Well, is there anything else that you'd like to talk about?
No, I just encourage everyone to stay safe, especially, I was watching Dr. Bonnie today at 3, and I think Canada and BC are doing a fabulous job, and I just want us to keep that up for the weekend. As much as we want to get together with friends and family, and the weather's so beautiful, I think if we can get through this hump, then BC especially will be doing very well.
Oh, well, right on. It's very nice to hear from you. Thank you very much for calling in.
Excellent. Thanks, Gareth.
Have yourself a good Easter.
You too. Take care.
All right, thanks.
Bye-bye.
Bye. So that was Christy Barry with Work BC. And I'm sorry, Christy, I did miss your text. Thank you for phoning in. So that was, again, Christy from Work BC talking about jobs that you can apply for at this time. And so that was great. Now, where am I? Let's look at... Okay, so the village of Cache Creek. So please be advised that in order to maintain physical distancing, the regular meeting of Cache Creek Council scheduled for April 14th, 2020 is hereby canceled. So next week there will be no council meeting. I thought there was supposed to be one yesterday. I was wrong. It's coming up on the 14th, but that one is now canceled, so we can't cover it. Unfortunately, I guess this is understandable, but you can still call and talk to CAO Dawson and Mayor Tallarico every day from 11 until noon. They'll be at the office to answer your questions, so please give them a call. And that is that one. What else do we have? I'll get to that in a second. I'm going to try and get through this as best I can because it's sometimes difficult to understand my own writing, even though I typed it out. I don't normally do this, but here is my opinion. So, I don't normally give my opinion. It technically isn't something that I am supposed to do, but here we are. In this COVID-19 situation, I personally do not feel that any government body or figurehead is to blame. Back when this was just a thing in China, no one was necessarily worried about it jumping over to other parts of the world. But once it was within Europe, specifically Italy, people still were not paying all that much attention. Canada, as a whole, was still giving billions of dollars to China to help them with their fight with this pandemic. My point is, no one has had a crystal ball in any of this, and no one to this moment has had a full handle on this pandemic. Actually, they haven't had a handle on it or how to fix it. Almost every day there is a change or new discovery as to how this thing spreads, or how long it can live on any given surface, or what the symptoms are, or what age groups are most at risk, or whether or not you can wear masks. So we as a population have never gone through something quite like this, and our professionals and governments are trying to keep up. All of the practices that are put into place are the textbook practices to fight something like this. The reality is a vaccine probably won't be finished for about a year. And from what I'm reading, even if you get sick and recover, doesn't necessarily mean that you are immune. What I see is if medical experts and government officials are trying to figure out whether or not this, are trying to figure this out without trying to create mass panic. I want to say that in my opinion, our officials are doing the best job that they can do. The CERB isn't perfect, but it would normally take months to roll out something like this. And they got it set up in just a few weeks. In BC, our medical leaders look tired. Every time I see Bonnie Henry talk about another death, you can see her face drop a little bit more. She is fighting very, very hard, and every death is a personal loss. Anyway, to everyone, keep up the good fight. The world would not be the same. The world will not be the same once this is done. Every country has given the biggest stimulus package in their own specific histories. Some businesses won't reopen, some jobs won't be there to go back to, and some of us have lost family and friends. But we are not. But you are not alone. We are stronger together. So that is my opinion. As bleak as it might be, I hope that that is a little bit more positive than what I was hoping to do. But anyway, moving on. As a reminder, there was a confirmed case of COVID-19 in Cache Creek. So if you were in the Cache Creek subway on March 24th, 25th, or 26th, please self-isolate. The infected individual was an employee. So if you had a sub made, again self-isolate for the next 14 days. And that is from Subway. Mentioned the story about frontline workers. So that is, do I have anything else to talk about? That might be all that I had. Let me just double check here. I think that's it. So I'm going to end with that. That was everything I have today. So thank you all for watching. Again, I appreciate everyone that watches. Please like, share, and subscribe this video. Let's get the word out there. We're getting about 1,500 to 1,700 views a day, which I think is amazing. So thank you all again. I'll talk to you tomorrow at 4 o'clock. And if you have anything that you want to say, talk about, let us... Oh, you know what? I should mention this one more time. Let me pull it up here. I'm going to talk about the group. Sorry, I apologize for the lag here. Okay, so if you need help, we have a COVID-19 helpline in Ashcroft, brought to you by a bunch of different people. Let me make this bigger here. So you can call, let me get rid of my number. You can call 250-457-3422 to get local help. They will get there are volunteers standing by to help you get food and supplies delivered to your home if you are self-isolating. You can, if you are lonely and need to talk to someone, there'll be someone that you can telephone chat with. These people will do your mail pickup. There are people there for spiritual support, especially coming into an Easter long weekend. That might be very, very important to your life. Also, the Hub Online Network will be posting a Easter special put together with St. Albans Anglican Church in Ashcroft. So again, call 250-457-3422. There's also a Facebook page with lots of really good info, which is the Ash Cash Clinton COVID-19 Community Info Board. The groups that are involved with this, of course, are the Ashcroft and District Hospital Auxiliary, the Ashcroft Hub, Ashcroft Moving Forward, Better at Home, CRS, Elizabeth Fry, Equality Project, Hospice, Hospital Friends and Family, Hub Online Network, MLA Jackie Taggart, MP Brad Viss, Sage Hills Church, St. Albans Church, Village of Ashcroft and Cache Creek, and many, many other volunteers. So those people are here for you. So please, if you need it, there's no reason for you to be going through this alone. Everyone is here to help. Now, talking about some of those other groups, let's talk about those groups again once I find their information. So the groups I'm going to talk about, if I can find them here, is Equality Project. So again, the Equality Project is open every Monday, Tuesday, Wednesday from 11 to 1. They're helping about 21 people a day, according to the numbers that they gave me yesterday. Very good organization based out of Cache Creek. So if you are able to donate, they're looking for longer term perishable stuff, but they do make hot meals for people. So they do have 2 people. They want to make sure that I say that they are practicing social distancing. So there's only 2 people in the kitchen and there's 2 people manning the table, social distance apart. And they're giving all the food that they can to these people in need. They are looking for other types of donations as well, such as toiletries. The other group that is looking for, so if you're able to help the Equality Project, please do. They accept donations Monday, Tuesday, Wednesday, as just like the days that they are open. The Elizabeth Fry Society is still doing their food bank. The food bank is open on April 14th, and you can still go and drop off donations by going to the E-Fry Society in Ashcroft, hitting the buzzer, and they'll come to the door, but they will also be practicing social distancing, so please keep that in mind. And there's a bunch of phone numbers that you can call as well, but I don't have them in front of me, so I apologize about that. The other group that you can get a hold of is the Soups On Ministry, which is based out of St. Albans Church. They are available on Fridays, and instead of handing out food, they're handing out vouchers to local restaurants, which I believe that the only 2 that are still open are Sam's Diner and the Central Cafe, who are both participating in this. Now, Sam's Diner, even though their open sign is off, they are still open. So if you're looking for something for takeout only, Sam lives right across the street. So you give him a call, he'll run back to the restaurant, make up whatever you're looking for, and then he'll go home again. So just because the light's off does not mean that he's closed. You just got to give him a call. So that is that. And I believe that now that is actually everything I got to talk about here. So thank you all. I'll let you all get out of here. Have yourselves a good rest of your Tuesday, and I will talk to you guys tomorrow at 4.